Hello y'all to another video. Today we're going to be doing CPR first aid. It's a BLS treatment and you can get CPR certified for this. Just note to self, the dummy is flat. It's because there's a hole in the neck. It's a small hole for my cat. And unfortunately I'm probably going to refill it a few times. The thing about CPR is what you're doing is you're putting your hand right here and you're pushing 2 inches depending how old the patient is. So if it's adult, you're gonna push here, and what that does is it stimulates, like, your heart continuing to beat. Like, attending to the ventricle, your heart's beating, and what it's doing is it's pumping the blood to your head and your body. When you're in a cardiac arrest, your heart's not beating, or the heart is going crazy, which means the heart's not beating, but it's like spasming, so your heart's going like this. And I'm not joking. If you look up a video, it's called VFib. That's when the heart spasms. If you look that up, it's gnarly, but you'll see where the heart spasms because it doesn't know what to do. The electrical impulses are not working effectively, and it causes spasm, which is a type of cardiac arrest, which I will mention sooner. And when you push on that heart, what it does, it's dead, but when you're pushing on the heart in the right depth and inch, is it beats. It helps beat the heart, and it refills with blood, and it will push the blood to your head, aka the brain, because your brain needs blood, but so does all the organs in the body. It keeps the organs alive, it keeps the brain alive somewhat, but unfortunately, not always will the patient survive. The other hard thing is with CPR is people kind of stressed out, and it's very common because they say, oh, okay, you're not doing this right, and like you're doing this all wrong. And you may feel that way, but you're not. I mean, you might, but you never know. This is why I'm teaching y'all this, is so y'all are aware of what happened in a scene like this. Cardio, or he's saying cardio, I'm sorry, that's still hard, but it's different what I'm trying to say. Anyways, a cardiac arrest can happen anytime, any place, anywhere. It can happen in your home. You can go to a store, a restaurant, and you're going to see someone collapse, kind of like this, out of nowhere. And it happens literally out of nowhere. This is why that's why I'm hoping that everyone learns a skill. And the good thing about this one, you can't try it at home. You can try a floor or a bed, and it helps you get the rhythm and the right pace. The other thing is, you go too fast, the heart can't refill enough blood to get through everywhere, and it's not efficient for resuscitating right, and this will lead to the patient dying. And you can't go too slow, because if you go too slow, it's not pumping like at a good rhythm, and you're not getting good perfusion. This is why I'm going to go 1, 2, 3, 4, 5, 6. And when you're putting the right depth, the heart is an organ, obviously, but it's one of the important organs because it's what pumping the blood for your brain and your whole body, including your other organs, to stay alive. So when you're pushing at least 2 inches, oh, that's my cat. Sorry, Thunder. Forgive me, buddy. Sorry, that's my cat. But when you're pushing on the heart, 2 deep inches, you want to go 2 inches deep. It may sound bizarre, but this is actually how you save a person's life. And what that does is it helps the blood, it put enough pressure to shoot the blood from right here up to your head. And your organ, the heart, aka, is the size of your fist. So that, like, this is the size of my fist. So this would be my heart itself. It's that big. And that heart, or not that big, but small, but like, that heart is still efficient enough, have the right pressure to push to your brain. That's why you go into it as deep, because when you go hard and you're doing right, it's pushing that blood right up to your head. That will help your patient. I don't think I mentioned this, but there's a hole in this, so it might have to repump it a few times. The other thing is about a patient is at the end of the sternum. Your sternum is midline right here, but about right, I can't really show you, but like right here, it's the end of the sternum. It's known as the xiphoid process. You never put your hand here. Never go here, and I will tell you in a minute. For CPR, you want right here, or direct. It's better if you go right here, because your heart sits right here, so pushing here is perfect. And the reason why we do not go at here, the xiphoid process, is actually because if you do that, that xiphoid process will guarantee to break, and it can shatter into small pieces, which can shred and tear your lining of your lung and your heart. And that will lead to blood loss, and they're doing CPR, and they'll possibly die, or, I mean, they're already dead, but what I'm saying is, like, there's not really a good chance that you'll save them because of all that blood loss. Cardiac arrest is mainly occurring for heart attacks, but other things can cause it. which is why you always want to keep an eye out, because when someone collapses, doesn't always mean they're in this cardiac arrest. This video is going to be a long video, because I'm probably sure y'all understand where I'm getting from. What was I going to say? Oh, yeah. Not everything is a cardiac arrest. Like, someone can collapse, but that just probably means they can be fainted. Like, they can faint. Like, it can be from them fainting, passing out. They're not actually dead, which is why it never makes a shoot to them. That's why if you see someone collapse, you're going to tap right here and say, hey, you're awake. I'm not getting the stuff yet, because there's still a lot more I'm mentioning. And here's another thing. If the patient is unconscious and you see someone collapse, you're going to go like this. Be like, hey, sir, are you okay? You're gonna, not hard, obviously, but you're going to tap like, hey, are you awake? See if they're verbal or responsive. If they don't move and they don't respond, that means you want to take more measures. If they do respond or like twitch a little bit, that means they are responsive, and you can check the cardiac pulse, see if there's any AFib. AFib is when you have an irregular rhythm. So your heartbeat is like this, boom, 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 boom. But when you have AFib, it's gonna go boom, 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 or it's gonna be like boom, boom, and it stops, boom, and it stops mid-beat, and it's go boom, and then it keeps going. It's an irregular rhythm, and you'll feel it in the cardiac pulse, because you can like try to explain. But kind of like I said, you'll feel it. It's a good, you can feel it. That's how you know. But if they're not responding and they're unresponsive, or not, I can't say that yet because you never did the painful stimuli. Basically, what I'm doing is something called off-poo. If your patient's unconscious, you want to see if they react to painful stimuli, if they're verbal, alert, or if they're unconscious or unresponsive. In this case, so far he's not alert, he's not verbal. So we can do something called painful stimuli. Don't try this at home, but there's a bone right here that you can push on, and it causes severe pain. And as an EMS, we do that. It's one of the ways we can do it. Personally, for me, I like to go by the tip of their fingernail, like right here. You could try this, but it will hurt really bad, so I recommend probably not doing it. But if you want to learn, do it. So you push against the nail. Then you put your nail, and you're pushing against the fingernail right here on the tip, and you push really hard. And what it does, it creates the nail does not like to be pushed down, and it causes really severe pain. Another way we can do is called a sternum rub. Your sternum is right here, not here, but up here. And you put your knuckles like this, and you're just rubbing slightly on the sternum. I'll do it to myself, just know I'm going to probably get hurt. I know it'll hurt, but don't do it too hard. If you do it too hard, you might break it. You just go lightly and just rubbing it. And because the sternum has a lot of nerves, and it causes a lot of pain, which you can see if they jolt or like react to the pain. If they don't react to the pain, you want to consider that they're not reacting to painful stimuli. And then the last thing we can do is this means they're unconscious or they're unresponsive. Means like they're not responsive to anything. In this case, this is where we get into the CPR. You check the pulse. Your cardiac pulse. Let me get a little closer. Your cardiac pulse is 2 from your sternum or trachea. I mean, I'm saying it wrong. So your trachea, aka larynx, right here. You go 2, so about like right here, and you can feel a slight rhythm. That means your heart is pumping the blood through the artery of your carotid. So you'll feel right here. And if you're right here, that's where I feel my pulse. I can feel the boom, 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 boom. You might get scared at first. It is, like, if you've never done it before, it is scary. It is scary, but for me, it's very cool. Anyways, we feel the carotid pulse. If we don't feel any pulse, it means the heart's not beating. Because the carotid pulse is by the trunk of your heart. It's really right by the heart. That's why the carotid pulse is the most effective pulse to feel when you have an unconscious patient. Another pulse we can feel is it's called the femoral pulse, but we don't do this one. Always go carotid, never go femoral pulse. I'm just showing y'all an example. So by your inner thigh, if you feel this right, there is a pulse. It's also by the trunk of the pulse, so it's called a central pulse. It means it's by the heart, and it's a good pulse to always check when someone's unconscious. On the other hand, if they're responsive, like if their heart's beating, we can check the radial pulse. The pulse, you go by your radial, aka the bone right here is your radius. It's always by the thumb. So I know how to do it, but if you feel right here, you can also feel a slight beat in your heart, or a beat in your hand, or arm, I should say. So now we're going to get into CPR. 1 second, I got to pump it. Actually, wait 1 second. Another thing is, if they are not responsive or no pulse, this means the person is in a cardiac arrest. And in cardiac arrest, you might see some agonal breathing. It's not it's a type of breathing. It's a fight or flight. It means the body can't breathe. So what it's trying to do is going like, it's like a. Maybe my math teacher told me this. Is you're open your mouth wide like a fish. So it's like, I'm not joking. They can't breathe. Like, I mean, they're in a respiratory arrest, and the lungs are trying to do whatever, like the brain trying to do whatever it can to keep the body alive. You know, unfortunately, agonal breathing is really scary to see. Because, like I said, they're going like a fish. Yeah, it's not cool. And unfortunately, this does happen a lot. Agonal breathing, we want to immediately start actioning. Just because you take agonal breathing, it could be called respiratory arrest. They can still have a pulse, but they're not breathing. In this case, you want to immediately start BVMing. If you have a BVM, you have to do mouth to mouth. If you have a pocket mask, which is the mask that goes around your mouth, kind of like a BVM, but you're breathing into it, it prevents germs. But if you don't have any of those, we need to mouth and mouth immediately. Because that means the lungs not breathing. When we push the air in, this helps the patient breathe. So, that being said, if they're not breathing, there's no pulse, and they're not responsive at all, this is where we help people to do stuff. Because people will not do anything. This is why we need to be a leader and step and act immediately. I'm teaching you all this because this is a really good skill, and not a lot of people know it, I feel like. And there's a whole group, and someone collapsed into a cardiac arrest. I was told that nobody, like really anybody, actually gets up because they don't know what they're doing, and they're scared they're going to mess up. And me teaching you all this skill will help you all save the lives. You all will know, and y'all can step in and hopefully save the life of this person who is in a cardiac arrest. This is where we, like I said, this is where we act. If we suspect a cardiac arrest and there's no pulse, we need to act fast. So you'll point at somebody, you'll go, hey you, go get an AED, tell another person call 911. In this way, two people have, like, instead of like multiple people like whispering, you have two people doing what you need. And the AED, what it does, it monitors a heart rhythm. So the heart monitor, another thing about a heart monitor is it can show you if it's VFib or TFib. I can't know if it's TFib or not. There's another type of fib, which means the heart is not beating. The heart's not spasming. It's literally like your heart is just like this. This one is slightly hotter. VFib is actually more better than the fib I'm talking about right now, which is where the heart stays still. Because VFib is the cardiac arrest is caused by a lot of things, but like I said, the SMA node and all the electrical impulses in the heart is not syncing right, and that's what causes spasming. And what the AED does is the AED shocks the heart, so it kills the old electrical impulse immediately. So that's where the heart will go still. And the thing about VFib, the thing about the AED is the heart will, like the heart can get the electrical impulse to go back to normal. So that's where the heart will go back to beating again. Not all cases, not all cases the patient will live, is what I'm going to say right now. But we can still try to save the patient. Another thing about the patients, you want to look for electrical, or not what am I saying? I'm sorry, people. Another thing you want to look out for is actually called a medical tag. A lot of patients will have a medical tag on their wrists. You look all over the body, usually the arms and the neck, for a necklace, or the wrist. Because the medical alert tag, it helps you see, okay, they have this condition, whether it's cancer, tachycardia, hypertension, or epilepsy. This will help you understand more about the patient with medical problems. Notice that the family will probably be there, not all the time, but if the family's there, try to ask about medical history. Like, if they ever had a heart attack, any heart problems, lung problems, anything that will help you know what caused the cardiac arrest. And the other thing is, you need to know, do they have a DNR with a document? Because the DNR means we cannot resuscitate the patient. And if you do CPR while they have a DNR, you can be sued for this. And they will sue you. Because, A DNR means we cannot resuscitate them because they know no matter what they're going to do, the patient is going to die. Without the documentation, we have our rights to do CPR because they can't prove it. I mean, they could probably sue you. They can try, but at the same time, they never brought the documents, so we don't know if they actually have a DNR. They could lie about it. So if they have a DNR for documentation and you read it through with the approval that the doctors wrote, like saying, okay, we allow them to have the DNR for this reason. If they have DNR with documentation, do not resuscitate. There's nothing you can do. You just call 911 and they will take the time of death because there's nothing we can do, unfortunately, for this patient. But if they don't have a DNR, this means we can begin CPR on the patient. That being said, that means you have everything you need. I don't have an AED, obviously, because this is my house. But I'm going to show y'all how this works. If y'all hear that, that's the hole. So y'all know that I might have to do this a few times. When you test everything, and you have everything done, you want to get on the side of your patient. Oh, I'm sorry. And you want to go by the sternum. You want to go hand like this on the heart, wherever your dominant hand is what I use. So I do my right, and I put my left, and I'm going like this. You're going to go like this. The ratio is 30 to 2. 30 compressions and 2 breaths per minute. And if, like I said, if you don't have a BVM or you don't have a pocket mask, you have to go with the patient. You want to open the mouth, and you're gonna open their mouth, and you're gonna breathe for them, like. And you will have to do this if, like, respirations. You don't have to do respirations, but it's recommended because it gives them a better chance of living and surviving. Or, like, sorry, when you do respirations with mouth to mouth, and you do CPR, there's a better chance that the patient will live. Sorry, I might do this a lot. It's really annoying. But you want to go on the left side of it, like right where the heart is, on the upper sternum, and you're going to begin CPR. You want to go 2 inches deep. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Go through the count. When you count, you make sure you have the right compressions. 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And like I said, when you go deep and you let go up, you always have to make sure the chest fully rises because that helps the heart refill with enough blood to pump it again to your brain and all your body. And after that, you'll open a person's mouth. So it's called a head tilt chin lift. You're going to push on their chin, and you're going to hold their head, and you're going to hold the chin, and you're going to do 2 respirations, 2 breaths. Do it for 1 second. Any longer, you're going to push a lot of air that can go right to the stomach, and the patient will throw up. This is why you have to make sure you're doing everything right, because the patient will throw up, and that can cause choking, and then they probably will not survive. As an EMS provider, which I am, I'm being kind of certified for it, but for a EMT, they have to suction the whole entire mouth when that happens. And a suctioning device, it's like a vacuum, and you put it in your mouth, but don't put it all the way in, but you're going to swirl it for about 9 to 10 seconds. No longer than 10 seconds, so do 9. And this gets all the junk out, so they won't choke on it. But as a bystander, you can't do that. Which is why you want to make sure you do the right breath. So you're going to do a head tilt chin lift, so push your head here, and push up lightly, and this chin will drop. Another thing is, make sure there's no snoring, because the tongue also can block the airway, which will also make the patient die if you're not. I mean, they have a hard time breathing. And what am I saying? They're not breathing, but you know what I mean. With that tongue, it blocks the airway, so not getting enough air in the right way. That's why I do a head tilt chin lift, because this lifts the tongue up, so we can get the air into the lungs. So, like I said, that being said, you do a head tilt chin lift, and you're gonna breathe no longer than 1 second. So, 1, 2. After that, you go back to CPR. And this video is going to be really long, so I love you all, and I want you all to understand that this is a skill that everyone needs to learn. Alright, that being said, we'll go back to CPR. The way I'm doing it is my hands right here. So again, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Oh wait, I'm doing it wrong. 1 second. 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And then you're going to go to the patient's mouth, head, toe, chin lift. And you have to put the mouth on the mouth. It's not, I mean, don't, like, it might be gross, but this helps save the patient. No matter what scenario it is, this is the only way we can make the patient live. And I'm also going to show you how to do CPR on an infant and on a kid. Kids also the same way, but it's a little different. So head, toe, chin lift. So 1, 2. Let's say that the AED arrives. The AED is where it gets deeper. Because the AED, we have to remove the patient's shirt. So we have to lift the patient's shirt up. And what we do, we place a pad. One pad goes right here. Yeah, it goes on the left. Wait. So one goes on the right side of right under the chest bone. So basically, one of the pads will go right here under the right side. No, on the left side. One goes on the left side of the breastbone, under breastbone. And the reason why is because your heart sits right here. This will help shock the nose, like all the electrical impulses. This will help. And the other one goes on the right upper part of your shoulder, like this. So it'll be like one will be like this, and one will be like this. After you got that, you're going to turn on the AED. There'll be a power button. You're going to turn it on. And this is where you need to pay attention at all costs. Because if you don't do it, someone else can get hurt. And this is very serious. And I'm trying to make sure you all know this. Because it has a strong enough shock that if no one touches the patient when it shocks, they will get hurt. This is where y'all pay attention. Also, if it's helpful, have another person do respirations and alternate CPR and respirations. Because this will help you all. It'll help you. Because CPR is very exhausting. And if you're just doing it alone, you have to keep going because you want the patient to survive. That's why you have another person, so you can do respiration to get tired. And the other person takes CPR until you all alternate and you go back and forth. And this also helps you. It'll help you all stay not as tired, and it'll help the patient survive. Back to the AED. The AED, when you turn it on, you can keep doing CPR. So keep doing CPR. When it says something about a rhythm, like analyzing rhythm. When it says analyzing rhythm, you say clear or get off. So you'll put your hands off. Because if you're doing CPR, well, it's analyzing rhythm. It's going to mess up the whole entire AED, and it's going to mess up the patient's chance of survival. So you're going to wait, hands up, let it analyze rhythm. This will determine VFib, or I think it's called TFib, but I might be wrong. If I'm wrong, just tell me in the comments, and I'll pin you, and then I'll pin it, and I'll put you in the next video, because God bless you. So VFib, heart spasming, or heart staying still, and it's not doing anything the way it should. If it has a irregular rhythm, if it has no rhythm, or you're noticing the heart's not doing what it's doing, like VFib or not VFib.
Excuse me.
You're good. Sorry, that's my brother DJ.
The downstairs bathroom.
He's I'm trying to make a video, buddy. Sorry. Love you, DJ. That's my oldest brother. Anyways, back to this. I'm sorry. But, anyways, the AED will help you check for VFib, or where the heart is staying still. I can't remember what it's called, but I think it's called TFib. VFib is what we, like, this might sound rude to you all, but VFib is more better than TFib when the heart's staying still. VFib, like I said, we can shock all the electrical impulses, and this will help us have a better chance of a survival rate for your person, wherever that may be. Do you take them downstairs bathroom, Mom? Do you take them downstairs bathroom? Also, I'm trying to make a video. I'm so sorry. I'm teaching everybody about CPR first aid. Oh, sorry guys. There's a lot of stuff going on, and I'm in the house, so yeah.
You done? Yeah.
But
I want to go down something.
if you notice there's no rhythm or the rhythm's not right, it's gonna say
I went downstairs.
it'll tell you everything. So listen to the AED at all costs. The AED will tell you everything what you need to do. So eventually it'll tell you to do something. Like what is that? Oh, it'll say charging up. When it says charging up, you can continue doing CPR. You say continue CPR. When it says clear, the AED will say clear. And this, if you're ever doing CPR or ever working at AED, you're gonna say clear, loud as you can. So you're gonna put your hands off. Everyone needs to have their hands off and stop doing what they're doing. And make sure nobody is touching the patient when the AED is on. If you touch the patient when the AED is on, and you push the shock button, whoever's touching the person will have an electric shock, and they will hurt themselves really bad. It will damage your heart. So when everyone's off, you push the shock button, and it will shock the patient. And then it's gonna say reassess the patient, and or something like that. And you're gonna keep doing CPR. You keep going. Like I said, you want to go deep. Like, don't go like this. Obviously, you're a patient. don't do that. But at the same time, don't go too light. One thing about CPR, I'm gonna tell you all something about CPR. Let me do this. The video is almost over. If y'all made it this far, thank y'all so much. Because this means a lot. And I'm hoping y'all are learning a lot from this. And the thing about CPR that will scare a lot of people is when you're doing it right, you can hear cracking. You can hear a lot of cracking on the sternum. The sternum and the ribs can break, and you don't hear really bad cracking noises. Just keep going. If you hear cracking, whether it's the sternum or the ribs, it's a good sign. The patient, if the patient survives, they will be hurt when they wake up. But you hear cracking noises, it means you're going the right depth, and you're doing CPR right. It may sound crazy, but you can look it up if you don't believe me. But it means you're doing it right. Keep doing that. At the same time, don't go too hard on the patient because you will hurt them really bad and you will damage the heart more. And that's basically all you do. You keep doing this, and eventually 911 will get on scene and they will take cover. So you will stop doing everything. And the EMTs and the paramedics, when they arrive, they might ask you a lot of things about. They'll ask bystanders, but they're going to ask you what you did for the patient so they know what they need to do to help the patient. And that's all it. That's basically it. Hope you all enjoyed the video. Hope you all had a lot of time learning. Sorry about my family, because, yeah, family runs. I hope you all learned a lot from this video. 27 minutes is my longest video, and I hope you all enjoyed. Because this helps save the person's life. I'm going to talk to you all a little more. This helps save the person's life. And it's recommended because you save a person's life. I mean, they might not survive, but in the good cases, you'll save a person's life. The family will thank you. And it's just a beautiful thing to watch knowing you saved someone's life. Rather than not helping them and then they die. Then you're going to have a big grudge because you didn't do anything. Or even try to help save a patient, or you're going to do it right. So I'm hoping this video gets a lot of views so people can understand, like, this is a real important thing. And everyone can do this. So, have a great night, or a great day, and thanks for watching.